Welcome back to MHW Clinical Rounds. And today we are going to be dealing with a very complex patient. She has congestive heart failure and she was on all the right medications, but despite that, her heart continues to get weak, and her previous cardiologist is recommending more procedures or surgeries to strengthen her heart. So, Camille, we have this patient with heart failure, Miss SB, and she came to us after being recommended upgrade of her defibrillator. Can you tell the audience about what's going on with her?
So as a recap, she has a history of congestive heart failure and non-obstructive coronary artery disease, and she already had a defibrillator, but because she has a left bundle branch block, her other cardiology team was talking to her that they would need to upgrade her type of defibrillator to what we call biventricular device or cardiac resynchronization therapy device, because her pumping of her heart, ejection fraction, wasn't getting better. It's actually been getting worse, down to 20%. And she wanted another opinion on that.
She was on all the right medications, correct?
Yes, she was on Entresto, carvedilol, furosemide, a diuretic, and potassium to counteract the side effect of low potassium on furosemide. And that's all she could handle.
So first and foremost, I just want to give a quick snippet on heart failure. And those of you who have seen some of our other segments, we talked about congestive heart failure. And congestive heart failure, simply put, is a syndrome where the heart does not circulate blood commensurate to the body's need. So the amount of circulation of blood that the body needs, say, for instance, when you get up and walk to the bathroom or when you get up and walk across the street, it may have to increase to a certain amount of flow. Flow is volume per unit time, a liter per minute, 3 liters per minute. And to increase the amount of volume of blood circulation, the heart just has to pump more efficiently. And sometimes a heart that's very stiff, it may squeeze normally, may be too stiff. So the stiffness doesn't allow the heart to feel, so it doesn't circulate normally. But most of the time when we talk about patients with congestive heart failure, it's a heart that's weak. It doesn't squeeze enough. Now, it's also stiff too. But if it doesn't squeeze enough, then the percentage of blood that squeezes out is usually less than 50%. 50% is sort of that lower range of normal. You want to do 50, 55%, maybe better 60%. If it's squeezing out less than 50% of the blood each time, then that's significantly abnormal, and she was squeezing out just 20%. So that's a weak heart. Now, typically when the heart's weak, we give you medications to relax the blood vessels, to allow the heart to circulate blood more. We give you medications to relax the heart. So we give you medication to reduce the stress and strain of the heart, so that allows the heart to circulate blood more efficiently. Usually that's the first measure. Patients get a little bit better. Sometimes we give them a diuretic because in congestive heart failure you tend to retain fluid. And if you're retaining extra salt and fluid, we need to kind of force that out of your body so you don't swell up too much in the lungs or the abdomen or the extremities. So she was on medications to both relax the blood vessels, relax the heart, to reduce the fluid. She had an implantable defibrillator in because heart failure patients in the setting of a weak heart are at risk for what's called sudden cardiac arrest. So they can have an abnormal electrical short circuit, we call an arrhythmia, that can cause a heart to beat fast and erratic. And if that happens and there's 911, no one around to shock the heart back into normal, then they can have sudden death. So she had a device in her that was monitoring her heart to prevent that. So she had really the best medicine could offer. Her medications were optimized to the point that her blood pressure was very low, so she couldn't really tolerate any other medications. She already had a defibrillator in. So we call that guideline-directed medical therapy. So associations meet and they come up with recommendations based on the science that they know to recommend, this pill and that pill is ideal. So these we're going to put in what we call the guidelines, either the general recommendations to cardiologists. You don't have to follow them 100%, but it gives you a guideline. And so this, the medical, so she was on the optimal medications based on what was recommended by the Cardiology Association. But despite that, she had the hospitalizations, her heart was getting weaker. So the next step, when you're on the best medications, the next step are procedures. You got to get more surgeries. So with her, she already had a defibrillator, but as Camille mentioned, she had an electrical abnormality called left bundle branch block. Essentially, when the heart sends an electrical signal from the upper chamber to the lower chamber, it sends it down electrical pathways. Your heart has its own electrical circuitry, its own wires. The most efficient way of sending signals down to the lower chamber is to send the electrical signal through all of the electrical circuitry. There's a main circuitry on the left, there's a main circuitry on the right. And when electrical signals go down the left and the right together, the lower chamber, the left ventricle and the right ventricle beat at the same time. It's synchronized. And the same thing in the upper chambers are synchronized because they have their own electrical circuitry. However, when the heart gets weak or damaged, some of the circuitry gets damaged. So if the circuitry gets damaged, perhaps the electrical circuitry on the left side is so damaged the signal doesn't go down the left side. It goes only down the right side and gets to the left part of the heart through some back circuitry. That creates a condition where the right ventricle contracts first and the left ventricle contracts second. So instead of the lower ventricles contracting synchronized in a synchronized fashion, they contract in an asynchronized or dysynchronized fashion. Essentially, you have a disorganized circulation. So what we can do from a mechanical standpoint is we can place an electrical wire or lead down on the left side of the heart and have it synchronized, connect to one on the right, and through the defibrillator generator, it can send a signal down to both sides and cause them to beat in a synchronized fashion. So this was a therapy being recognized. So many of you may know loved ones with defibrillators, and some may get defibrillators with 3 wires, 1 in the upper chamber and 2 in the lower chambers. They may have what's called a resynchronization device. So the electrical system gets damaged, the normal synchronized beating of the heart goes off, and so it's dysynchronous. And so you have to resynchronize it by putting a wire, and that's another procedure that has to be implanted. And it can be pretty effective therapy, So I've seen patients with the resynchronization therapy get better, and the ejection fraction gets better. So it wasn't a bad recommendation by her cardiologist. However, the patient was nervous about this, so she wanted some other options. So it behooves us, give her other options. And even though this was a good option, it wasn't a right option for her. Where are we now then? So what, she didn't want to have that done?
Yeah, so she had seen us initially in November, had a few kind of sporadic visits because she was seeing her other cardiologist too. She had made some changes to her diet, so when she came back in March, she had been doing maybe 70% plant-based.
70%, oh my goodness. There's a cuss word that's more than 4 letters that patients come and use, and that cuss word is moderation. There's no worse profanity that I know of when you're trying to make a lifestyle change. But this isn't just, a bump or scratch. I mean, the frustrating thing oftentimes about patients, I want to do something natural. You have to do this 100%. And then they come back, I did it 80%, 70%, and that's not enough. And it potentially gets the patient in trouble because the resynchronization therapy is not a bad recommendation. But it's also not totally unreasonable to say, is there anything else I can do? But if you try to do something else, you need to do something else 100%. Yeah. When I planted resynchronization device, I didn't put it in 70%. I put it in 100%. If you do a surgery, a procedure, you do it 100%. You either do the procedure or don't do the procedure. Right. So if you're going to have an alternative approach to the procedure, you don't do the 70% alternative approach. and compared to 100% of the procedure. I mean, this is frustrating. What's the 30% that she's doing?
She did sometimes eat some more snacking processed foods like Fritos. I think she did seafood a little bit, but a lot of times it was the salty snacks or such like that.
You know, Fritos are not free. I mean, it can cost her a whole lot. It can cost her her heart. So,
Yeah.
and I'm not trying to be mean, but it's just that we have to emphasize to her that it's important to be 100% compliant.
Her heart had been getting weaker since the diagnosis. So, she'd already been hospitalized right before she was first seen by us. So we know that we see people with heart failure that, if we start to see those hospitalizations become more and more frequent, that's a very poor prognosis. So maybe her being 70% prevented her from being rehospitalized in that time. There's a chance, but
It's possible. How long has it been since the previous hospitalization?
now that would be about 5
5 months.
months.
We can't give the disease state an inch, and so we have to really emphasize to her that we have to be 100% compliant. What did you share with her, and where are y'all right now?
At that visit, we kind of sat down and said, okay, you have 2 options. And like you were saying, it's either get this upgraded device or you have to really give this 100%. We are hopeful that going plant-based will help you, but we are more confident if you do that 100%. Our patients who do it 100% have had improvement when they also have a left bundle branch block. But, we can't guarantee that this is going to work if you don't do it 100%. Everybody's different as an individual. She really did not want to go under the knife again. She didn't want surgery again.
So she didn't want the surgery, yeah. We can guarantee it won't work if you don't do 100%. I'm not too confident with it right now, but let's do this. Let's keep working with her. Let's give her the outline. Let's spell it out 100%. Our phrase, not a bite, not a drop, not a crumb. We have to be 100%. I'm not too encouraged, but let's keep working with her. Let's try to follow her more closely, okay? Let's get some other lab works, and then we'll come back and see how she does, but we'll see. So, I don't know, guys. I'm not too confident where we are right now, but Camille's going to keep working with her, and we'll see where we are. Stay tuned, and let's see how this saga ends up. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our